Good morning, everybody. How are y'all doing?
I'm doing good this morning.
Good. My first day back in the office. I took an extra day off yesterday to get some yard work done, so I'm a little bit behind, but that's all right. I enjoyed that weather yesterday.
It was really nice yesterday. It was
Yeah.
nice to be outside all day.
Uh-huh. Yeah, we get a discretionary day, and we have to have ours used by the 19th of December, and I checked the weather last week, and as far as I could see, and I was like, you know what, I don't want to take any chances of using this free day in December when it's cold and terrible weather, so I better go take it now. So I know we're gonna have several members emailed and said they wouldn't be able to make it today, so but I'll give a few more moments for anyone else to join. Okay. We can go ahead and get started. Well, welcome everybody. Thanks for jumping on this morning. Hope everybody had a good weekend and having a good start to your week. Um, we've got our agenda here today. We're going to go through, I think it's going to be pretty quick, the first pieces here. I don't have too many updates, and so we'll do the member updates, and then we'll jump into our work groups, the work group overview and what we have planned for that. So go to the next slide. So really the only update we have for you all since the last time we met, I just wanted to briefly touch on the Office of Early Childhood. The transition director, Zach, did reach out to all the programs that will be moving last month, and we do have some planned what they're calling town hall meetings for all the staff that are moving. So that was good to see. We've had one, and we actually have one this afternoon. So it'll be here at our KDHE office building. So, but it's just a good time for them. They're going to do try to do their best to keep us updated what's going on. Try to be transparent on everything, just letting us ask questions. And obviously, this is a big change for everyone involved. So I think they're just trying to be transparent as much as possible and keep spirits up and keep momentum going into the new office. So if there's things we hear that we're able to share, we will do that. But just wanted to give you all an update on that there is communication happening with the programs, and we're going to keep moving forward with that best way we can. So next slide. All right. So yeah, this is, like I said, it'll be short update for us, but we do want to hear about what you all have going on. So if you want to come off mute and let us hear what kind of work you have going on in your area, bright spots or in positivity going on. So I'll turn the floor over to whoever wants to come off mute.
Hi, this is Dana with the Northwest Kansas Innovation Center in Hayes. I'm happy to announce that I might have said this last month. I guess you just have to listen to me say it again. The Patterson Family Foundation gave us a grant to pilot a home-based provider recruitment program. We have almost all of the policies and procedures ironed out. That will happen. It'll be officially open for business January 1st. So we're pretty excited about creating some new home-based slots in Northwest Kansas, which sometimes works better for us than a larger center. So we're excited about that opportunity.
I would love to share. This is Melissa Bowles. We have been working here in Manhattan, the CBI, with our providers that are within there now. And I'm happy to report that we had a provider, just kind of a laid back meal with them the other day, and got some great feedback just from supports that they've already received. I know that Melissa had came down and toured the center and spoke with Lisa about what we had going on. But also, we're going to have our first fundraiser for it here on December. Well, I guess it's technically the second one. We just did one with the Flint Hills balloons, but now we are going to do a parents' night out to allow parents to do some holiday shopping and then do a gift wrap the next day. And I think one of the best parts about it is we've gotten a few high school kids in the early childhood field to come along and work for that event. So that will be exciting. And we continued our meetings with them, which have been great.
Melissa, can you explain what CBI is?
It's just the childcare business initiative.
Okay.
And so it's with the Flint Hills Community Accelerator Program. We received a state grant for a lot of it, and then the rest of the funding came from local um, people who donated locally through different businesses and working with our Chamber of Commerce. So I've been helping with that project from the beginning, just as a representation for family childcare. So it's going well. Like, I'm excited about it. There's a couple girls in there that have reached out to me multiple times asking for support with contracts and just coming in to kind of see their space and what they can do to, like, they're really, I love it because we have some that are very much into wanting to do it all right and do it right away. So it's kind of like I'm having to put the brakes on them a little bit, like, okay, let's work on this first. But yeah, it's been great. So it's fun to see a lot of different agencies working together to support that program.
Fine. Thanks for sharing that.
So, Jarvis, I'm going to tag on. This is the other Melissa to tag on to what Melissa just said. What I think is really unique about the incubator site is it's funded via grants, as Melissa said, through the Children's Cabinet, and the Riley County Foundation was was an amazing partnership in there. But it doesn't just host childcare facilities. It also it has a partnership with the Manhattan Votech, which starting next year, they will be in 2026, they will be offering courses for anybody wanting to go in through the early childhood field through the Votech. It also hosts there's an outreach clinic for families or any community member who has no health insurance. So it's open 1 day a week, and so it's a walk-in clinic that you're able to make appointments. But what's really been a great advantage of it being on site is it supports the child care facilities. So on those days that they are open, if there's a child that is sick, the families can immediately just have access to health care. And it's also going to host and house Kansas Works. So it's supporting families and community members in addition to how to create a resume, how to, look for jobs. So it really is it is more than just the childcare. It's a community incubator meeting needs, and we have 10 of those across the state. So looking forward to sharing some more on that. But Melissa is correct. I was there last week, and I just left with a big smile on my face, looking at the providers and then thinking about the whole support system and knowing that then, the whole goal of the incubator site and the innovation is to then transition them out after a year to the community and then host another 8 providers. And so the pipeline that they're building there and the support system is just amazing. So shout out and kudos to the Manhattan Group and what they're doing. And can't wait to hear, after that first year of what that crop looks like. And appreciate providers like Melissa who are mentoring and supporting current providers to keep everybody going.
I think another thing, Melissa, I don't know if Lisa told you while you were there, but we are putting together a proposal to present at the National Family Child Care Association just on the project, and how our community has been able to come together with multiple different agencies to support providers, and just not only the providers, but also being able to support the educators within other areas, such as the high school, working with the high school students that are coming into the field, whether it's the healthcare field or the workforce area, just because we do have all those different agencies within there. And the big greater room that is there is open to the public to use as well. So if somebody's needing a space for an event, they're able to use that, which will be great because we will be moving our childcare appreciation event over to the CBI this year, which is exciting as well. So I'm excited. It's fun to see the early childhood program at MATC coming together. Been working on that curriculum. There's a team of us that have been working on that as well. And I mean, Lisa's got a lot on her plate, but she's getting it done. So it's been fun to watch. Of course, there's been bumps, but we're making it through.
That's exciting. That's very cool. I mean, to be involved in, like I said, not just childcare, but a whole community, initiative like that.
Melissa, did you say that there were 10 of these types of setups when you were talking? Melissa,
I did. So they're all in different processes. Yeah, so we can, we're working on site visits and gathering information, and 10 just sticks out of my brain. So it could be 9. Don't quote me on the 10. I'd have to recount. But we could bring some of that innovative, you know, work and share more robustly with the systems improvement team, if that's something that you guys would like,
I
and
think,
pull together
isn't
some
there,
of the different ways that they're tackling childcare and their community initiatives.
Mhm.
I think there's 10. There's also other ones across the country. They're just set up a little different. I think the one in Manhattan, what sets it apart from the other ones is the fact that we have every entity that is involved in it has their own space. I think that's the only difference. We're all housed in one spot. So like the health side of it, they have their own little suite. Each business, each family child care business has their own suite. Manhattan area technical college, that's the big greater room. So there's that training room. And like Casito has been able to go in and do some trainings there. Raising Riley has been able to use that room. I actually, as a family childcare provider, will be using that room for my family holiday party. And then the Kansas Works office has their own entity as well, which is kind of a little bit different than other ones across the, but and I know that there's other programs similar to this across the country, in fact. But I think we're like the one in Connecticut, I know the most about, but the one in Connecticut, I know that they pay providers to be in that space. These providers, it's their own business, so they do pay a rent, which helps offset some cost for the greater building. But yeah, it's a very low rent, I should say, but it gets them off on the right foot. And then also with that, just having that mentoring going out there. So it's exciting though to see it moving across the state. I'm also excited to hear about the Northeast Kansas, or sorry, Northwestern Kansas provider one that is getting started up too.
Yeah, so we could, to your question, I think Anel asked that question, and we could and can coordinate with Jarvis and the systems improvement group, and we can share some of the highlights of what our grantees are doing, because most of them are all housed together, and they have all tackled the project uniquely to meet the needs of their community. So very exciting things that are happening. Manhattan is more operational, so that's why we can definitely see some movement, but there's a few others that are very operational too. So yeah, love to share more.
And I think that'd be a great idea. I think the more we can get those ideas out there and what's going wrong in different communities, the better, we're going to be able to help other communities. So definitely would like to see that. So, right. Anybody got anything else they'd like to share this morning?
Good morning. My name's Lori Leanter, and I am with the Wyandotte County Health Department Child Care Licensing. Something pretty cool we were given the opportunity to do is we went out and presented to one of our local high schools to 4 of their human development classes, and we were able to do, and so that was over 100 students total at the high school level, that we talked about the field of early childhood as a professional, choosing childcare regulations and professional organizations. So just kind of the whole gist of early childhood for over 100 students.
Lori, what did that look like getting into to be able to do that, to be able to present at the high school? Was it during school? Was it like a club or yeah, what did that look like?
Yeah, it was for their human development class. So their instructor this is actually the 3rd year, but this was the largest group. Usually it's just one presentation or maybe 2 sections, but she has a full load of 4 of those sections this year. So
Mhm.
we were just invited back, and we were able to update it and kind of change with the times and the changes that have been made to us.
Cool. Thanks for sharing that. I think that's exciting. The more we can get those kids early too, yeah, the
Yeah.
better.
Our hope is to expand to some of the other school districts in Wyandotte County, but right now I've got an in with Piper, so that's where we are.
Mhm.
And there's some exciting movement in the Turner School District, so that's going to be my next approach, is to see if that's something they would be interested in as well.
I'd like to hear more about that too. And, like I said, getting other communities involved and to be able to, have opportunities in their high schools to do the same. I think that'd be great.
Jarvis, I don't know if you can see the chat, but Dana mentioned they did something really similar at Hayes High in their human development curriculum, and yeah, I think that's a popular topic, and I think could be a really great thing for us to kind of brainstorm on together and see how people have done that in a future meeting.
Yeah, definitely.
Are you guys doing that through the career and technical education program? Or just on your own?
Ours is just on our own. The district that we're with has academies now, so they have a Health and Human Services Academy that the early childhood fits in under. I know that academy, or that area, is going to be moving to a different one of their academies next year, but we'll see what that looks like. But no, just through the school district itself. And
I was only asking, I have worked with our career and technical education program here in Manhattan for, oh gosh, it's probably been about 10 years now, where their high school students that are doing their work-based learning actually come in to my family child care and just kind of learn the ins and outs. And it's been great. And if any of you out in your communities, I want to say Hayes, I know for sure has the CTE program, and I know that there's schools up in Kansas City. I don't know about the smaller rural schools, but I know that there are quite a few of the schools across the state that have that CTE program. And I think it's great because they're sending those people who are interested in the early childhood field not only into childcare centers, they're sending them into homes if they can find a home that's willing to host them. And then also they are sending them into kindergarten classrooms across the different programs, at least I know here in Manhattan. So hopefully that's happening in other areas.
I could piggyback onto that, Melissa, that in Hayes, I don't know if they call it CTE, but it is that sort of program. I came and talked to them for an hour or so, but they routinely place kiddos from the high school that the district runs an early childhood childcare center and preschool classrooms. But beyond that, I also know, especially some of our school districts that are owning and operating childcare centers, almost always there is some carryover with high school students that volunteer in those facilities, as just part of that overall program. So we're seeing quite a lot of that, which I think is a good thing to try to identify those kiddos that might have a tendency to want to do that sort of work in the future. So that's good.
Yeah.
Something else that was exciting when I was out there, the instructor for that class did let the kids know that with their so they're trying to make sure that they have workforce assets when they leave, that if any of them were interested in pursuing the foundations module through Casito or their first aid and CPR training, that that's something that the school district would pay for and provide them time and opportunity to complete those things. So I thought that was a pretty cool addition.
I think at Hayes High, they'll pay for their CDA, the getting them on their way with their CDA classes. I should also say, I forgot, the Ellis County Child Care Task Force, which I'm a part of, they have lots of career fairs for the students, and the task force always has a child care booth up at those events as well.
We're getting some good information this morning. Appreciate everybody. Anybody else got anything they want to share? All right. Well, thank you all for that was good conversation. I appreciate it. And I think we definitely got some notes we can take and check into some of that, some of those initiatives you all have going on. So, okay, we can move on to the next slide.
So we're going to spend the rest of our time today starting our work groups. So hopefully you saw the email that Bree sent out with the list that you are either selected or were assigned to, which hopefully everybody's okay with that. If you have any questions about what group you're in, just let us know and we can make sure you're in the right place. So in a few minutes, we'll open breakout rooms and you'll be able to select your work group and join. As a reminder, we've got 3 work groups: promotion and marketing of licensed childcare programs, innovative childcare models, and strategies to retain childcare facilities. So each work group will have a facilitator. It'll either be me, Jarvis, or Clayton from our CPPR team. That will have kind of a note-taking template. If you've been on this group before, this will look very familiar. But the idea is, like, we know people have to miss meetings and things happen, and so you'll have notes that we'll send out with the meeting notes, so you if you aren't able to participate in a meeting, you'll be able to follow along. Today this is like, we always spend the first month meeting just really like kind of putting all the ideas of things that the group could be talking about over the next few months out there. So I would encourage you to think big. Like, there's no such thing as a bad idea in this group. Remember, we do try to keep it within the realm of childcare licensing. I know that can be challenging at times, and there are a lot of things that are like licensing adjacent, and historically we have had those conversations. So for example, I think a lot of things with workforce might technically not fall within the childcare licensing scope, but certainly directly impact childcare licensing. And so we can navigate those ideas. So don't worry about it. If it again, like, this is the time to share all the ideas. And if we need to kind of whittle down, we can do that over the next couple of meetings. In terms of like what the timeline and hope for the groups are, I would say we tend to kind of go at least 3 months and then just see how it's going. We have put quite a few formal recommendations forth from the work group, so that is certainly a pathway. Again, if you've been in this group before, that'll look familiar. If not, there's a pretty standard kind of template of what that might look like, but it's a recommendation that the childcare licensing team implement something, review something, like whatever that kind of verb is. And we'll work with you along the way to figure out what that looks like. It also doesn't have to be a recommendation. I think that tends to feel like the default option, but we don't want it to feel like it has to be that. Sometimes that can feel really formal. And sometimes it's saying, hey, this group over here is doing this really great. I'm just going to use the CT example. This is made up, but like maybe you see an opportunity with like, hey, somebody else is doing a lot with CTE and like high school students. We have a recommendation that there's more collaboration between childcare licensing in that group. Something like that's not the best example, but sometimes it's about just kind of identifying opportunities, and it doesn't have to necessarily be new work. It's just kind of saying out loud, we think this is important. So again, we'll work through it as we get there. I know that feels a little bit abstract. It usually kind of starts taking its own form as people narrow down their ideas. So for today, we're going to break out into groups. We won't come back together. We will ask that each, at the beginning of the meeting, moving forward, we'll do kind of report outs on what your work group talked about. We really want people to feel connected to all the groups. Obviously, we can all only be in one place at one time. And so if you're like, oh, I'm in this group, but I really want to know what's happening over there, like we want you to know that. And again, you'll be able to see everybody's notes. So we want, it's the work group's focus, but ultimately these are like actions on behalf of the whole systems improvement team. So we want people to feel connected and like they know what the groups are doing. This isn't on the slide, but if you, depending on the work group's ideas, if you ever need to like bring somebody else in that's like a content expert or bring information in, let us know. We can do some digging in between meetings. Occasionally it's like, oh, I think this group over there is and somewhere else in the system is doing something. We need to bring them in to understand what that looks like. We can certainly we'll just kind of check in after each work group session and see what needs to happen like that. So yeah, I think if there's somebody who wants to share updates at the next monthly meeting, if you can identify that, that's great. If that's the facilitator this time, that's also totally fine. I know it's going to feel probably like a long time between now and our December meeting, so we'll need refreshers. But again, we want everybody to kind of know what's going on in the groups. Are there any questions before we start the breakout rooms? Okay. Well, hopefully this feels like the fun part. I mean, it's always fun in this group, but I mean, make it sound like that. But like, this is really where I know people have talked about really enjoying being able to like take some action and like really kind of dream big in this group. So I'm excited to get these groups started again. I know we have quite a few people out today. There were some other conflicts with meetings, so we may have some smaller groups, but that's okay. So Bree, I think when you're ready, if you want to start the breakout groups, again, if you're not sure what group you're in, Bree will be in the main room. So you can talk to her, or if you have any issues, like if you get kicked out of Zoom, come back in and she'll be there through the meeting time. So she can get you back in the room you need to be in. But hope you all have a good time with your breakout groups.